Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 28 in our series of questions for residents, medical students, and fellows studying for the boards or in-training exams. Well, let's get right into it. A hockey player complains of persistent hypothene or deep pain. X-rays were negative for abnormalities. What is the next step in management? A, rest. B, CT scan. C, EMG nerve conduction study. D, bone scan. Or E, ultrasound. Well, here's your chance to pause the video so you can think about the question and answer it. A hockey player, baseball player, or golfer complaining of persistent hypothermia or pain with negative x-rays would benefit from an advanced imaging study. CT scan is classically the most cost-effective next study and has nearly 100% sensitivity. It is highly sensitive for cortical disruption. If the CT scan is negative, then MRI can be ordered in patients with a high suspicion. MRI is the more sensitive for bone marrow edema and also images other anatomical structures in the area. This is a cross-sectional diagram from Gray's Anatomy where the hook of the hamate has been highlighted in red, just so you can see its reference to other anatomical structures, including the ulnar nerve, which is sitting very close, and the flexor tendons to the left of them, and the carpal tunnel. The hook of the hamate forms one of the walls of the carpal tunnel, and the motor branch of the ulnar nerve wraps very closely to it, around it, and so it is in danger during surgery, and you need to be sort of aware of where its location throughout any kind of surgery where you're excising the hook of the hamate. The treatment of choice for hook of hamate fractures is excision, even in high-end athletes, especially in high-end athletes. Now this is a CT scan of the hook of the hamate, but this is not a hook of the hamate fracture. This is most likely an os hamuli proprium, which is an extra bone in the area of the hamate, because basically the hook of the hamate has a separate ossification center, and sometimes it doesn't end up uniting with the main part of the hamate. So this is an on the differential diagnosis for hook of the hamate fractures, but it's a rare finding. So the answer to the question is B, CT scan. I think if given a choice between CT scan and MRI on a board question, I would order CT scan. But if there's no CT scan offered, you could answer MRI as well. I think many times clinically we order an MRI, especially I think in younger patients where you're trying to limit radiation dosages for. I often order MRI instead of CT scan, but I think for the board answer, I would use CT scan. Hope you enjoyed the video, hope you learned something, and we'll see you on the next one. Remember to like and subscribe so you can continue to support this channel.